Resume recording. Okay. Good evening, everyone. My name's Jenny Fitzharding, and I am a clinical counsellor and volunteer with NEA BPD Australia. And I'm really happy to welcome you to this webinar, which is going to be talking all about validation, which, as anyone who's been through the Family Connections program knows, is such an amazing superpower. But before we get into that, I just want to acknowledge country, and that in the spirit of reconciliation, NEA BPD acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples here today. And just a quick introduction to NEA BPD Australia. Our aim is to support families and carers of people living with a personality disorder, which we believe can affect up to 17% of the population. We're a volunteer-run organisation supported by over 200 volunteers right across Australia. And we're one of the 26 countries around the world that offers the Family Connections program. Family Connections is a 12-week evidence-based program that provides skills and hope to family members and carers. The program is offered free of charge to participants and is led by our volunteer leaders who generously give their times to support other families. We receive no government funding and rely solely on the generosity of our family and supporters. So to those of you that were able to make a donation tonight, or if you're watching this webinar, just go to our website and you can make any donation is gratefully received, because that helps us keep the lights on and keep getting this fantastic program out there. So yes, as I said before, tonight's topic is validation, and we have an incredibly well-qualified person to present on this tonight in Dr. Jenna Traynor. She is a clinical psychologist and clinician scientist, and she conducts research within Maclean Hospital, which is one of the most prestigious hospitals in the States, for those of you in Australia, in the Division of Mental Health. Her research and clinical practice focuses on treatment for borderline personality disorder, trauma-related disorders, and other conditions associated with high suicide risk. And I am now going to hand over to Jenna and ask her to tell us a little bit more about who she is.
Thank you very much. And it's an honor to be here. So thank you for the introduction and the invitation. And again, thank you to everybody who's tuning in, whatever time it is for you. I know it's 7 a.m. for me, which is a great time to be presenting. I'm definitely a morning person. So thank you to those who may not be as energized or awake at 9 p.m. right now. So today I'm going to talk about validation skills. And I also wanted to talk about a little bit about the brain biology kind of underlying validation, because I think it's really cool because I'm a scientist, but also I think it helps us really understand what's going on in the brain for people who have borderline personality disorder. And it's interesting because I actually started my PhD studies focusing on studying the brain in autism. So my entire PhD thesis actually used MRI brain imaging as a window into the autism brain. And I never really planned on working with borderline personality disorder. And it wasn't until I had my very first clinical placement in grad school where I actually got to observe a therapist doing psychotherapy with a patient who had borderline personality disorder. And I found myself just completely fascinated by something that was going on in the room between them. This patient kind of came into therapy very, very hopeless, very suicidal, and had spent much of their life feeling very alone and very unseen by other people. And I remember just feeling particularly inspired by the ability of this therapist to really make this patient feel so seen and so heard. And I just remember thinking, what is this? Like, what are these strategies, and how do I learn how to be a therapist that uses this type of communication? And what I actually later learned, of course, is that the therapist was using validation skills. And so validation skills are really what got me into wanting to work with people with BPD. And so I love teaching validation. And I never kind of let go of my background in MRI brain imaging. And so today I'd really like to incorporate kind of both of those things into the talk. My outline will kind of start by touching on the biosocial theory of BPD development, particularly because I think it's just so foundational and fundamental to understand why validation is so important when we have loved ones with BPD, or if we're working with clients with BPD as clinicians. And then I'm going to move into talking about some of the brain biology that underlies validation, kind of what happens in the brain when we experience validation, or the opposite, when we experience rejection or being insulted or criticized. And then I'm going to end by talking about 6 validation strategies that tend to work really well. And then we'll do questions. Okay, like I said, I'm going to start with the biosocial theory. The biosocial theory was developed by Dr. Marsha Linehan, and of course, who developed DBT. And one of her aims, I think, with formulating this theory was really to reduce the stigma around the diagnosis of BPD, the unfair and inaccurate stigma that unfortunately still exists, and really help individuals cultivate more compassion and understanding for the experiences of their loved ones. And so, when I'm practicing DBT, the first step would be to review the biosocial theory with families and individuals to really help families better understand the symptoms of borderline personality disorder and how they emerge across time. So, as humans, kind of whatever role you might be in, maybe you're a parent, mother, father, maybe you're a child or a niece or an aunt, we can't really help or support our loved ones if we don't feel compassion, or if we don't understand correctly what's going on. So the biosocial theory gives us this kind of container. So the biosocial theory says that BPD is primarily a dysfunction of the emotion regulation system, right? And I always like to use the metaphor of a tap. So people with BPD often find that it's really hard to modulate the temperature of emotions, right? So oftentimes it feels like all of a sudden the hot water is on full and it's burning, and there's no way that I can kind of turn down the temperature of the water, or vice versa. And so because of this, we say that people with BPD are what we would call more emotionally vulnerable, right? They're more prone to experiencing emotions in very distressing ways. And we know that this is related to early stress that's experienced in relationships. So BPD is an attachment disorder. It's a stress-related disorder that stems from being born more emotionally vulnerable, kind of biologically, and having that kind of intersect with growing up in some type of invalidating environment. And we will talk a little bit about that in a moment. So the core emphasis of the biosocial theory really says that there's this poor fit between a child's biological predisposition to experiencing emotions more intensely and an environment that is just not a good fit for someone with such high emotional sensitivity. So borderline personality disorder develops over time with this interaction between this biological sensitivity and an invalidating environment. So the first component, this biological sensitivity, this is a result of our own biology. So we kind of every one of us falls somewhere in the spectrum from low to high in these different dimensions of emotion, right? So if you're listening in, I would maybe encourage you to think for yourself as I go through these, which characteristics you might kind of endorse. Where do you fall on these different spectrums? So the first one is emotional sensitivity. And when we see people who are high in emotional sensitivity, this means that it doesn't really take much to evoke an emotional reaction. So a very sensitive child, for example, might react to even the slightest frustration or disappointment. Emotionally sensitive people, I'm also one of them, might really cry often at sad movies or books, or be kind of deeply bothered by political injustices, and maybe more likely to internalize criticism as well. We also know that there's strengths to being emotionally sensitive, right? So people who are more sensitive are often people who love animals. They maybe are musicians. They're often very passionate or artistic about something. So being low or high on any of these spectrums actually isn't a problem. It's when this biological predisposition then is kind of interacts with an environment that is a poor fit to respond to that. We also see the spectrum of emotional reactivity. So we all fall, again, somewhere on the spectrum from low to high. This is kind of people who are high in reactivity often go from like 0 to 100. It feels like there's a really fast kind of emotional response, and they react very strongly to things like the absence of loved ones or hurting another friend's feelings. Often families who have a loved one high in emotional reactivity will have kind of the feeling that's associated with walking on eggshells. So we don't really know when an emotional reaction is going to come, but when it does come, it's at a 100. And then we also know part of emotional vulnerability is time needed to return to baseline. Whoops. Time needed to return to baseline. So after something stressful happens, how long do I need to kind of get back to my emotional homeostasis? People high on this spectrum need a long time to recover. And often the problem is that before someone has recovered, another stressful event happens. And then so it can just feel like, being on a roller coaster all day long. So this is what we call kind of emotional vulnerability. And people who go on to develop BPD, they tend to be high in one or more of these spectrums. And then we know that this emotional vulnerability then interacts with an invalidating environment. And an invalidating environment is one that communicates to a child, often unintentionally, that their emotions are not understandable or that there's something wrong with them. So, a key feature of an invalidating environment is that it tends to punish displays of emotion. Sometimes intentionally, often unintentionally. I really want to emphasize that. A benign example that I could give would be, say you have a child who just threw a toy across the room in anger, and a parent responds by saying, "Go to your room. That wasn't nice. Go to your room." For a child very, very high in emotional sensitivity, this can be experienced as very rejecting and kind of is not what is ideal for this person who's very emotionally vulnerable, despite the fact that this type of parenting response is quite typical, right? So one thing that I want to emphasize is that the development of BPD is actually nobody's fault. It's not the fault of the person with BPD. It's not the fault of parents or caregivers. It's really this mismatch between what is needed and what can be. Another feature of the invalidating environment is that it will, while at the same time kind of rejecting emotion, it often unintentionally reinforces emotional escalation. This is kind of the key feature here. If we think about the primary function of emotions in humans is that they are meant to serve some type of communication, to get some type of message across through facial expression, through body tone, through words. When emotions are rejected or punished or not heard, this kind of sends the message that the emotional communication was not received, right? And when somebody has a really important emotional message to send, they will understandably escalate the intensity of the communication and the intensity of the emotion. And this is actually not specific to BPD. We all do this. We've all done this, and will all do it in the future. Think of a time in your life maybe where you or someone you cared about wasn't listening to an important message that you had to share with them. How did you react? Right? Maybe you raised your voice. Maybe you spoke more dramatically with your hands. Um, Maybe you got mad, or you kind of froze up or walked away frustrated, right? But you escalated in some way, because this is what we do as humans when we have something really important to share. And so over time, usually what happens is, if, for example, a parent isn't getting an emotional message, and kind of increases efforts to stop, like, hey, go to your room, that, calm down, the child will escalate more. Maybe they'll start screaming, right? Or maybe they'll throw something again. And this kind of goes around and around. It's reciprocal between kind of a parent or caregiver escalating and saying, no, this is wrong, go to your room. And then a child like screaming louder, being like, no, I'm upset, right? And it's kind of like this tug of war. And this continues until somebody stops and gives in. And usually it is the receiver of the communication who gives in when they realize that the sender is actually quite distressed and upset, right? And when the receiver kind of gives in and says, whoa, like, you're really upset. Okay, let's sit down and talk about this. This is how emotional escalation gets reinforced unintentionally. And this is kind of the transaction we see across development in people who go on to develop borderline personality disorder. So over time, kind of the person's biological system learns inherently that if I want a message to get across, I have to send it with a lot of emotional intensity. And so sometimes people with BPD then have the experience of, I need to ask something and I immediately feel emotions at 100, because that's kind of what happened in childhood. Now, I do want to emphasize that there are many potential sources of chronic invalidation across one's lifetime. It's not always inside the home. So, for example, children who experience chronic bullying at school, children who experience invalidation in the church, children who may have had a sibling with a disability or a chronic illness that required a lot of time and attention from the parents. That can be experienced as invalidating because there just wasn't enough resources to pay attention to everybody equally, right? People who grow up different from others in some important way, like having a disability or different sexual orientation or different race. If you feel often different from others, this can also be a source of invalidation, right? Even sometimes when boys or girls aren't acting or behaving in the ways we think boys and girls should. For example, a girl who is really interested in mechanics or working on cars, she's probably not going to receive the same level of validation from people in her life about her interests, the same level of enthusiasm as if she was interested in dolls or makeup or hair. So there can be some gender kind of based factors that factor into invalidation as well. Okay. I'm seeing some like squiggles on the screen. I don't know if that was me, and I'm sorry if it was. I didn't mean for that to be there, but it's not a big deal, but I just wanted to acknowledge that. Something must have happened with my drawing feature here.
I'm not sure. Yeah, other people's names are coming up. Ellie, I don't know if it's you, Ellie. Please stop drawing on it. And there was another name came up as well, Margot. So I'm desperately
Okay.
going through everything, trying to find out
No
how
worries.
people have got access to that, and also to how to rub it out because I can't see the drawing tools. So
Yeah.
as soon as I find them, I'm
Well,
going to
maybe
delete all of those for you.
that's okay. The
So
slides
sorry.
are some abstract art to decorate the
Yeah, oh, here
slide.
we go. Someone's found a way to delete. Fantastic. That's great. Okay, I'll
Um,
let that go.
Thank you. Thank you. Um, So, and, the thing I really want to emphasize is that BPD is no one's fault. It is not the fault of the parent or the caregiver. It is not the fault of the invalidating environment. And it's certainly not the fault of the person with BPD. the biosocial theory says the most important thing is that there has been a poor fit, like two puzzle pieces that don't fit together, between the biology and biology related needs, emotional needs, and an environment, right? Rather than the degree of either component. So I do like to give some examples around some of us can have like very low biological vulnerability to emotion, but grow up in an extremely invalidating environment, right? So if there were instances of abuse, for example, or racism or transphobia or homophobia, even somebody with very low biological vulnerability may develop BPD if they grew up in an extremely, extremely invalidating environment. We also see people who have average biological vulnerability. They're somewhere on those spectrums, but they also grow up in a higher kind of invalidating environment. Um, and then we see people with really high biological vulnerability, exquisitely sensitive children who are often very well attuned to what's going on in the environment. They can really feel other people's emotions. And the environment is averagely invalidating, as most environments are, right? Invalidation is a part of life. We all grow up in an averagely invalidating environment at a minimum. And this person can go on to develop BPD because, again, the fit just wasn't there. So I just want to take a moment to really drive home the point that it really is nobody's fault. Okay, this is though why practicing validation skills are so important. Most people with BPD have experienced ongoing invalidation to such a degree that it was felt as traumatic, right? It really changed them. And so validation skills are so important to learn and practice, not only with people with BPD, with everyone. So before we jump in, though, to a review of the 6 validation skills, I just want to take a look at kind of what happens in the brain in people with BPD when they perceive or experience invalidation. So my research uses MRI brain scanning, which is able to take a picture of the brain and measures how the brain is kind of functioning in real time as research participants, often with BPD, complete different kind of cognitive or emotional tasks while they're in the brain scanner. And through this type of research, we've really gleaned that there are 2 kind of main brain systems that are highly disrupted and very different, both in their anatomy and also in the way that they function in individuals with BPD compared to those who don't have BPD. And so the first one is we call it the frontal limbic system. By far, this is the most well-known kind of research network in the brain in BPD. There's this very, very primitive almond-shaped structure deep in the subcortex here called the amygdala. And many people have probably heard of the amygdala. The amygdala is like our fear center. It's often the fire alarm that goes off when it detects any type of danger or threat. So when we are really upset, when we're very scared, when we're very angry, our amygdala is on fire, so to speak, right? It's really, really activated. And we also have this area at the front of our brain, under our forehead, that allows for processing those amygdala-driven emotions, right? And it really helps us to control those emotions or inhibit emotion-driven behavior when we need to. And so this whole system, kind of a good metaphor for this system is kind of the gas and the brakes, right? The amygdala is the gas producing a lot of fear, and then the prefrontal cortex is the brakes. I think by far the most common finding in the literature is that people with borderline personality disorder have too much gas and not enough brakes. So the frontal cortex does not come online to help regulate and slow down emotions as it can in people who don't have borderline personality disorder. So it makes it a lot harder to regulate emotions in real time when you have BPD. The good news is that therapy, like dialectical behavior therapy or mentalization-based treatment, can actually rebalance the gas and the brakes. So there's a lot of cool MRI research showing that we can actually change the brain, and I'll talk a little bit about that in a minute. But I want, I'm going to take a few points today to try to get us to cultivate some compassion. So I want you to kind of imagine a time where you felt intense fear or intense anger. And, this is the kind of experience people with BPD may have on a daily basis, right? Especially if they have never done therapy, but even maybe if they have, it's very stressful and it can lead to emotional burnout. So again, we just want to cultivate compassion for kind of what's happening for our loved ones. Now, if we take a closer look at a very tiny area of the frontal lobe called the medial prefrontal cortex. Research has also shown here, it's over here on the right side, that this area is also different in people who have BPD. So the level of brain activation in this area of the brain, so essentially the amount of kind of blood flow normally flowing through this region, is strongly linked to the capacity to have empathy. And when I say empathy, I mean kind of understanding or putting ourselves in somebody else's shoes. Strongly linked to empathy and the ability to understand other people's emotions. And in humans, as we mature from children into adults, this area of the brain really shows early and continuous activation when we are perceiving and understanding the intentions of other people and the intentions of ourselves. And a really cool kind of study shows that it's called the cyberball. There it is. A part of this medial prefrontal cortex is actually activated during a popular social rejection task among scientists called the cyberball game, which involves a participant with borderline personality disorder being put into the MRI brain scanner and playing this ball toss game with two other avatars. And the game actually ultimately ends up excluding the participant from the ball toss game. So the avatars end up only tossing the ball to each other, and they exclude the person with BPD. Now, in people who don't have borderline personality disorder, this part of the brain really comes online during types of social rejection like this. And we think this helps kind of buffer against the negative effects of rejection or invalidation. But this research actually shows that in people with BPD, we see that the more rejection distress they experience as a result of being excluded from the game, the less activity we see in this part of the brain. So they really don't have this part of the brain that can come on and kind of buffer against the effects of rejection. So social pain is hard for people with BPD. There are many other social cognitive disruptions in BPD as well that further speak to the need for validation. So number one, we know that trustworthiness appraisal is impaired in BPD. In the lab, when you show people with BPD pictures of faces that span from kind of like positive, happy faces, trustworthy faces, all the way to like scowling, untrustworthy faces, compared to people who don't have BPD, people with BPD are much more likely to judge these kind of neutral, maybe a little bit happy faces as scowling or untrustworthy. So there's really a difference in perception, in facial perception. So can you imagine kind of walking around the world where people are walking by you and they might have a neutral face, but actually perceiving that as like a scowl or somebody who's not trustworthy? That is not a positive experience. And this is correlated with, rejection sensitivity. So the more sensitive someone with BPD is to rejection, which is a really common feature of the disorder, the more likely they are to perceive other people's neutral faces as threatening. We also know that there is some fMRI research linking difficulty appraising trustworthiness to less activity in brain regions that help us make decisions, right? So seeing somebody who looks untrustworthy and then like not having the brain activity to really understand how to make a decision, a social decision about that, is also experienced with people with BPD causing a lot of uncertainty and a lot of anxiety about how do I behave in these social situations. And in a cool way, a study that I completed during my postdoctoral fellowship in Canada, where I'm originally from, we looked at the brain in BPD, and we actually found that empathy impairments in people with BPD, so people with BPD who don't have a lot of empathy or who have difficulty with empathy, this is actually linked to differences in the brain's memory system. And this part of the memory system is actually thought to be involved in this term called rational interpersonal updating. And rational interpersonal updating is really our ability to change our thoughts or our narrative about another person as we get to know them better. So if somebody makes, a really bad first impression on me, but then I meet them again 2 weeks later and they're wonderful, I might think, okay, that person was just having a bad day, but I don't think they're a bad person. But for someone with BPD, we know that rational interpersonal updating can be impaired. And so oftentimes there's a difficulty in BPD changing or updating an impression of an original impression from someone, which can take a toll on relationships. Okay. I want to come back to this kind of area in the mentalizing or empathy area that I talked about when I was talking about that game, the cyberball. So especially in the mentalizing network, and when we say mentalizing, we mean the ability to kind of understand the mental states of other people and ourselves. We, again, are seeing different brain activity in this network when people with BPD receive negative social feedback. They don't have the same type of brain activity as people without BPD. And we see these types of differences even when we compare people with BPD to other populations that struggle with mental health. So for example, people with low self-esteem, people with low self-esteem, or self-harming people without borderline personality disorder, compared to all of those groups, people who do have borderline personality disorder are showing disrupted activation in this kind of social, cognitive, mentalizing area of the brain in response to perceiving insults relative to compliments. And we actually know that this area is disrupted during both social rejection and when people with BPD are being included. So this really speaks to there's a real exquisite neurobiological sensitivity to social pain and social decision-making, inclusion in people with BPD that really make it hard to regulate emotions during all of that, and can often be linked to really distressing BPD symptoms. So we know that people with BPD experience suicidal ideation in response to perceiving somebody as cold or aloof, right, rather than warm. And that there's also a role for really high negative emotion in that, right? It causes really high negative and low positive emotion. We also know that dissociation, the symptom of dissociation in BPD, has been shown to be a coping mechanism that allows a temporary escape from interpersonal conflict or interpersonal distress. And that, all of this is kind of mediated by levels of negative emotion. So there's a lot going on. There's a lot of negative emotion. The brain is functioning differently. So taken together, I hope that these findings really underscore the importance of using validation and cultivating compassion for our loved ones with BPD and their experience. I'm going to end this neurobiology part of the talk on a good note. I know I've talked about a lot of differences, but I also want to highlight that the brain is something that we call plastic. You may have heard the term plasticity or neuroplasticity. And basically what that means is that the brain is malleable. The brain is always changing. Even anatomically, like the size and the volume of our brain structures are changing quite rapidly sometimes, from month to month, or sometimes even longer. But we can change the way that our brain functions, right? And so one positive kind of study that I want to leave us with before we get into validation is a study that recruited a group of participants with BPD and showed participants images depicting social scenes of loneliness, along with personalized narratives that the participant had written about a time where they felt distress in an interpersonal situation. And they put them in the brain scanner and they showed them these pictures and read these personalized narratives to them. And before doing dialectical behavior therapy, the participants with BPD showed a lot of increased activity in that fear center of the brain, the amygdala, in response to the images. So the fire alarm, the emotional fire alarm, was going off on high to those pictures of loneliness and those really distressing interpersonal memories. But after dialectical behavior therapy, they repeated the experiment, put them back in the MRI, and the activity in the amygdala in response to those images and narratives was no longer any different from people who did not have BPD, so a set of control participants. And so I think this is really, really good to know, because we know the brain is malleable and it can be changed. It can be changed with psychotherapy and DBT. I also think it could be changed with validation skills. And so I want us to kind of know that when we are practicing validation, that we are, it is on a biological level. We are making biological changes for ourselves and our loved ones. So with that said, I think I will jump into talking about validation. So what is validation? I think many of you here probably already know. You might be from NEA, or you maybe have done family connections, but validation is essentially communicating what makes sense about another person's experience in the current context. So when we're validating, we are looking for, what is it about this person's feelings, behaviors, actions, beliefs? What is it? Is there something here that I can communicate that makes sense? That is what we're doing when we validate. So we're not being nice. Validation is not being nice. It's not agreeing. It's not approving of someone's feelings or actions. It is trying to communicate about what makes sense, about what somebody is experiencing. It's letting them know that you get it, right? And allowing them to be seen and understood through communication. Now, everybody on this call probably knows validation is really hard, really, really hard. And so it's a practice. And when we are validating, what I really want to emphasize is important is that we're trying to find the kernel of truth in someone's experience. And oftentimes, some of the questions that I read that already came in were around, well, how do I validate something that is really against my morals or values? I have a son or daughter who might be using substances or lying, and I don't know how to validate that, right? So, for example, how could a parent respond to a teen who has relapsed on substances during exam season, right? So what we want to do when we have instances like this is we want to find the kernel of truth, or the needle in the haystack, that is the part that we can validate. So certainly we do not want to validate something that is invalid. So we don't want to validate that it makes sense that somebody would be using substances. We don't want to validate that it would make sense that somebody's lying. But what I try to do in instances like this is I try to validate what might be going on underneath in terms of the emotional experience. So I might say something like, wow, it seems like you were really, really overwhelmed this week and desperate for relief from your anxiety, right? So I'm not even bringing the substances into my validating statement. I'm focusing on validating, yeah, you were really, really overwhelmed this week. It would make sense that you would want something to take your anxiety away. It would make sense that you would want your anxiety to be gone. Again, I'm not saying it makes sense that you use drugs to do that, but I am focusing on, yeah, when I feel really overwhelmed, I certainly want a way to reduce my anxiety. And I'm sorry that you were so anxious this week. That sounds horrible, right? So that's how I might find the kernel of truth in someone's experience when there might be a lot about their experience that I don't understand or don't want to validate, and that's okay. So I did say, validation is certainly not agreeing. So even if you disagree with someone, you can still validate something about what they might be going through. I think that's maybe the hardest part to wrap our heads around. Validation is also not getting your own point across. So I think there was a question about how do I validate when I also want to remain firm in my own point. When we are really focusing on just validating, we are just focusing on just validating. So listening to what somebody is saying and finding what is valid in what they're saying. We're not focused on, and then I'm going to tell you how I feel, right? Which is often the urge, especially when we're in a heated conflict or really hard situations. But validation has nothing to do with trying to get your own point across. And that can actually be counter to doing validation well. There are times to get our point across, but it's not when we're trying to validate someone else. So there are many validation strategies. We can validate all the time. We don't even need words to do it. This one I used to be not so interested in, but now I am, because after COVID and how everything went virtual, everyone's on their phone all the time. So the first validation strategy that we want to use when we are with a loved one is we want to stay awake. At the bare minimum, we want to stay awake. And we want to make eye contact with that person. We don't want to be falling asleep. We don't want to be using our cell phones, right? Oh yeah, you had a bad day. While we're kind of doom scrolling, right? We don't want to be in the middle of kind of listening to something really important, and then our pager goes off and we're like, oh, sorry, hang on, I just got to get this. It's a work call, right? So it seems very basic, but actually in today's virtual world, it is so hard to put our phones away, and it's so hard to be away from technology. So the first validation strategy is really sitting and giving someone your full attention, which can be so, so powerful on its own. I don't know if you've ever had a friend or a loved one where it feels like when you're with that person, they are just able to have so much capacity to be with you and listen to you, and you feel so connected to them, right? That's kind of what we want to cultivate when we're using the validation strategy of staying awake. Similarly, if someone is telling me something really important, I might want to also lean my body in forward, really show interest in what they're saying. Okay. So that's the first strategy. The second strategy is called reflecting back. So reflecting back is where we listen to what somebody says and then we paraphrase it and we repeat it back to them in order to determine whether we heard them right. So an example might be your mother is upset that you didn't call her to let her know you made it home okay after you agreed that you would. She yells at you and says, I cannot believe that you would just leave me hanging and worried about you again. So she's really, really mad. If I'm going to reflect back the essence of what she said, and again, reflecting back is not word for word saying what they said, it's paraphrased. I might say something like, I've made you so worried for me by not calling like I agreed to. And on top of it, you're feeling ignored. Am I hearing you right? Right? So reflecting back is really helpful for loved ones where it's kind of hard to know what's bothering them. They might kind of be the types of loved ones who shut down a lot. They can be difficult to read. So it's really helpful for you to reflect back kind of what's going on. Am I hearing you right? To determine whether there's any type of miscommunication going on between the two of you, which is often the case. So it's really good to ask, I heard this, am I getting it, right? So similarly, your child comes home from school, appearing anxious, flustered, and irritable. You ask how they are, and they respond with, "How am I? I've had a horrible morning. I don't even know. I can't even think. The last thing I need is you interrogating me," right? I might respond with something if I were reflecting back, like, "Oh, you've had a morning from hell. You'd rather not talk about it. I get you," right? So I'm not saying, again, exactly what they said. I'm just reflecting back that I hear them. When we're reflecting back also, I think another tip is that sometimes a loved one might say something really self-judgmental, right? "I'm so stupid. I didn't get to class yesterday. I missed my bus again." If we're reflecting back, we might say something like, "Oh, you didn't get to class yesterday because you missed your bus." But you want to leave out the kind of "I'm so stupid" self-judgment. So it can also be a way of kind of modeling to other people how to kind of lower judgments or recognize judgments and kind of leave them on the shelf. So reflecting back is a really good tool. And I would suggest that if you're in an argument with someone, reflecting back and saying, "Am I hearing you right?" can be a really powerful way to increase communication. Okay, so the next strategy is mind reading. Mind reading is so cool because often I think if you've done any type of therapy, maybe you've been told, like, don't mind read. We don't have a crystal ball. We don't know what other people are thinking. So especially in like CBT type therapies, it's like, don't jump to conclusions about what someone's thinking. When we're doing validation strategies, we're jumping to conclusions about what someone is thinking, but we're jumping to tentative conclusions, right? We're almost in a sense asking, but when we're mind reading, we're trying to kind of preemptively predict and express what that person might be thinking, right? So your son did not get a job that they interviewed for. You might, knowing your son really well, say something like, "Oh, he must be so disappointed," right? Like you're mind reading the emotion that he might be feeling before he even tells you. Similarly, your niece saw a new specialist for suspected fibromyalgia and reported that the doctor just dismissed their symptoms. I might say something like, "Oh, I'll bet that was so frustrating. I know you had your hopes set on understanding your condition better today," right? How frustrating. Your partner was fired from work, but admits they didn't tell you for a couple of weeks. I might say something like, "I'm guessing you might have been worried about how to tell me. I know we've talked a lot about the importance of finances right now," right? So when you're mind reading, you are taking a guess. And there's a lot of good reasons for using mind reading. One of them is that it feels really good to be around people who just get it, right? I don't know if you have a friend or a family member that you can think of where they just get it. They just know what you're feeling before you even tell them. It can feel like a really warm and safe experience to have somebody do that. I think it says that, "Oh, this person is quite attuned to me. They know me very well. I feel very seen," right? Um, we know also that some people with BPD struggle with something that we call alexithymia. And alexithymia is really an inability to know what they're feeling. So if somebody with alexithymia might be able to say, "I feel bad. I'm feeling really bad. I'm having a tough morning," but they're not able to be more specific with labeling emotions more specifically. So they're not able to differentiate the emotion or the feeling of shame from anger, from sadness, from loneliness, right? And so mind reading can actually be a way to model for people like that what they might be feeling, right? Getting them more familiar with linking stressful situations to specific emotions, right? So as a DBT therapist, when I first start working with someone who has borderline personality disorder, I use the strategy of mind reading a lot more if they have trouble identifying emotions. And the hope is that by the end of therapy, that person will have developed or cultivated more of an ability to label their emotions more specifically. One caveat that we always have to remember when we're using mind reading is that we have to be willing to be wrong, right? We're taking our best guess at what someone might be feeling, but we have to be willing to be wrong. And if our loved one corrects us and says, like, I'm not actually disappointed, I didn't get the job, I'm relieved, I didn't want that job. Whew, as soon as I got the message, I was like, right? We would have to accept that we were wrong and be like, oh, you felt relieved. Okay, tell me more about that, right? So we're not mind reading to be right. We're taking a guess, and then we might get a correction, and we have to be willing to be corrected. Okay. Okay, that's mind reading. So there's a couple more, and then maybe I'll take some questions. We can also validate other people by understanding what's going on for them in the context of their own history or biology, right? So if I know, for example, that somebody had a bad car accident last year, it would make a lot of sense that they'd be nervous to drive through the intersection where the accident happened. So if I was with a friend and we were driving to the theater and they were having, panic symptoms or anxiety symptoms, I might say, it makes a lot of sense you'd be nervous about driving through that intersection. Of course, I mean, you had your accident there last year. Right? That would be validating in the context of history. Similarly, if I was, talking to a friend or a loved one about feelings of mistrust, which are very common in borderline personality disorder, I might validate, again, based on history by saying it would be really hard to trust new partners when most of your romantic relationships have ended with you discovering that you've been lied to, right? It makes total sense that it would be hard to trust. Right? So instead of criticizing them by saying something like, you need to get over this trust thing if you ever want to find a partner, I would validate by saying it makes sense that it's really hard to trust. Right? Of course, you felt tired after your work party. You have social anxiety disorder. Your brain was on high alert all night, right? This is validating in the context of biology or validating in the context of a diagnosis. It's a lot harder for people with social anxiety to attend a work party than it is for people without social anxiety. So we always want to, when we're validating, and maybe often when we're having trouble finding that kernel of truth, we want to be looking at what in this person's history makes sense and can be linked to their current feelings or beliefs or actions. Okay. This is kind of related, so we can normalize. When we normalize, we're telling someone there's nothing wrong with you. Most people, a lot of people, the majority of people would feel the same way or would act the same way, right? Of course, you took the day off. Breakups are hard. How could you expect to be at your best exercising while you're sick? I'm sure most of the examinees had nerves too. Test taking is anxiety provoking, right? Sometimes even a simple me too. Oh my gosh, me too. Oh, I was so worried about that too, right? That can be so normalizing and very powerful. When we see other people experiencing the same things that we are experiencing, it feels good. It feels like we're a part of a community, right? And we need that as humans. I suspect that this is why meme culture has taken off in such a strong way, right? People are sending memes to each other all the time, like with no context, because the meme speaks for itself, right? I do this with my sister. I'll send her a meme and she'll send me memes. And I was thinking the reason we really like doing that is because memes are normalizing, right? It's saying that I'm not the only one going through something like this. There's humor in the fact that so many people are having the same experience, right? So there's this commonality of human experience, and that can feel really nice. Okay, the last strategy I'll talk about is called being radically genuine. And this is kind of similar to maybe when I asked you to think about that friend or loved one that just gets it, right? They just know you, and you can really trust them to be transparent. There's really nothing more powerful, I think, than having someone in our lives that we can trust enough to be themselves around us. And so being radically genuine, we add the word radical here. It means we are taking off any mask that we have, and we are speaking so directly from our hearts to somebody. And so sometimes this looks like just telling somebody, I have no idea what to say to you right now, right? I've done this with patients before where they come in and they just tell me so much about what has happened, so much grief and loss in the last little while. I sometimes say, I'm having a hard time even knowing what to say to you right now. Like, holy cow, that's unimaginable. That's unbelievable, right? I don't need to find the perfect validating statement because I just, wow, I'm blown away by what you're going through right now. I really feel that. That is an example of being radically genuine. Another example might be taking what we would call a one man down approach, right? So if someone's really angry at me, I might say something like, I've realized I haven't done a very good job listening and I want to do better. So it's genuine in the sense that I'm acknowledging my part in this, and I haven't done a good job, and I'm willing to accept and admit that. Right? Hearing that from somebody can be really, really important. Being radically genuine, though, can look a number of different ways, right? If you ever, go visit a friend and maybe you're having an off day and you look a little down and you come in and they say, how are you? And you're like, fine, I'm fine. And then they're like, how are you? I'm not buying that. What's really going on, right? They know you so well. They kind of call you on that. That can also be really validating because it's like, oh, this person knows me so well that they know when I have a poker face on. Right? The last example of being radically genuine would be to say something like, I wish I could say yes, and I can't right now. Right? So I think there were some questions in the chat around, I forget the exact question, but how do I validate when I also want to like stick to my own limits or something like that? So I wish I could say yes. I want to say yes. I want to make you happy, and I just cannot say yes right now. And I'm sorry. Right? So there's a lot of different ways that this can look. I would encourage you, if you there's a book called Loving Someone with BPD. I think it talks a little bit about how to be radically genuine, but it really is how can you be radically you with that person.
Okay.
So just wrap. Oh yeah, sorry, go ahead.
Sorry, no, go ahead. Sorry, I thought.
Okay. So just to wrap up, I want to talk for a moment about the spirit of validation, and then I'll show a short, funny video that I think maybe many people have seen before, but I still love it. The spirit of validation is that it always has to be genuine, right? So if you truly can't find something to validate, don't validate anything. We don't want to validate the invalid, but we certainly don't want validation to be perceived disingenuous, right? So Marshall Linehan says validation is not throwing the dog a bone, right? We don't just validate so that our loved one will calm down and then we can get back to our TV show or book, or then we can get the real important point that we want to say across, right? That's not what we're doing with validation. We're also not trying to problem solve, right? The goal is to just kind of listen and get it. We're not trying to problem solve or fix anything. We just have to listen sometimes. So with that said, I'm going to end with this short, funny video called It's Not About the Nail, which I think really, really embodies what validation is. And then I'll take some questions. I hope you can hear the... Oh, I hope it will work.
While it's buffering, I might get one of the questions in. Oh, here we go.
It's just, there's all this pressure, and sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? because I mean, I'll bet if we got that out of there.
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing.
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail
I'm
out.
not even listening now.
Okay, fine. I will listen. Fine.
It's just sometimes it's like there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
That sounds really hard.
It is. Thank you.
Oh, come on. If you would just
Don't.
try to see things my way.
Okay. Oh, we'll stop there. Okay, great. Well, thank you for listening to my talk, and I hope it was helpful, and I'm happy to take any questions.
I might get you to stop sharing screen.
Oh, yes, sure.
Yeah, that was awesome. I really, personally, it was funny because we were watching another presentation recently with some other colleagues, and we were saying, oh, it'd be really nice to know whether there have been any brain scans done on people pre and post, psychotherapeutic treatment.
Mm-hmm.
And so it was really great to hear that has that work's is being done, and that you're seeing results, which is fantastic. Because the fact that BPD is treatable is something that we really, really need to get out there.
Yes, absolutely.
And so the first question would be, in that vein, was how long does DB take for there to be a perceptible improvement for someone?
Yeah, that's a great question. So typically, for forever, we thought it needed to be at least a year or more. And now there's new research, a large clinical trial that came out showing that actually 6 months of DBT is just as, is non-inferior to 12 months. So essentially, people have the same outcomes and the same reductions in symptoms after 6 months. And even very early on in DBT, within 3 to 4 months of treatment, the first symptoms that will start to go away are self-harm and kind of risk-taking and impulsivity symptoms, which are often quite distressing for individuals and their families. So it actually doesn't take a long time. BPD is very, very treatable. And dialectical behavior therapy is gold standard treatment, as well as mentalization-based treatment, so MBT.
Yeah. Yeah, I know anecdotally with that, we do 12-week DBT programs for teens over here with their families, and like for some kids it's not enough, and for other kids it really makes a huge difference. But has there been any sort of like brain scan stuff done around, like seeing that difference after 6 months or seeing that difference after
Yeah. Yeah. I don't know if the brain scans are around 6 months to 1 year, but there are definitely brain scan studies, I think from researchers in Germany, who show that often, they recruit people with BPD who are engaged in non-suicidal self-injury, so like cutting or burning. And they actually put them in the scanner and they apply like a painful stimulus to their arm, like heat or something in the scanner. And before DBT, that pain actually regulates the emotion system in the brain. So we know that self-harm actually does serve a regulating function. And oftentimes that's why people do it. And then when people do DBT, they put them back in the brain scanner and they give them the pain again. And actually the pain elicits the same response as it would in somebody who doesn't have BPD. So the emotion regulating function of self-harm is kind of corrected or normalized with DBT. I don't know if that was 6 months or 1 year or more, but the brain is so malleable, and so these things are so treatable.
Yeah, that's amazing. So a lot of the questions are around, I mean, I've sort of grouped them into self-validation. So, like when the person with BPD, or the diagnosed person is saying, it's all your fault, you're the source of all my problems. You're the worst parent in the world. You were emotionally abusive or something, and that parent's genuinely done the absolute best that they could. And given what you were talking about with the bias towards negativity in people with BPD, how do you get to a position where you can validate?
Mhm. Yeah, I mean, I would say when someone is coming at you with criticism or aggression or saying you're the worst person and I hate you, or you're making this worse for me, it's really, really hard. That's probably one of the hardest situations to validate in. Um, if I were to try to validate in that situation, I might say something like, you are really upset with me. I can see that you're really hurting. I can see that you really, really, that our relationship is hurting. I've really upset you. Um, so I would be like reflecting back the hurt in the relationship rather than maybe defending myself or correcting that person.
It's that
It's
me too,
hard.
isn't it? Like we teach people the me too shortcut to
Yeah.
validation, and it is that me too. Yeah, I'm hurting. I'm so sad that we're not getting on right now.
Yeah, yeah. Like I wish too that we could, I see that you're so mad at me and I really wish we could find a way to come together and talk about this. Let me know when you're ready to do that. I'd love it. I'm not sure, and then of course this talk was on validation, but there are so many other skills that are needed. So, setting limits, which is of course out of the scope of the talk today, but knowing when the right time to engage in conversation is and to try to validate someone is. If somebody is just so upset, and you've tried validation and it's not working, it's okay to take a break. You can say something like, and maybe we aren't in a state to really use our validation skills very well because we're so upset. I might say something like, you mean a lot to me, and I really want to be in a state to be able to really understand and hear you, but I'm so upset right now. I'm going to take 20 minutes and I'm going to come back because I love you and you mean a lot to me. And I can't right now engage in this conversation.
Yeah, and sort of
So
step into that space of validating yourself, of going, it's really tough to be accused of this stuff when I know that I've done the best I can, and yeah, and maybe
it,
find other people that can validate you, isn't it? Like
yeah,
having that
yeah,
support there.
yes.
Um, a lot of people, because obviously, DBT and other treatments like MBTI, um, uh, sorry, I've conflated the wrong thing there, but anyway, mentalization-based treatment are effective when we know that, but what do you do when the person with BPD is saying, no, it doesn't work for me, or I don't want to do it, or how
Mhm.
can you help someone to get into treatment in that situation?
Yeah, that's a tough one. I mean, my honest answer is that if somebody doesn't want to do treatment, they're not going to do treatment.
Mm,
There's no way that we can force somebody to do treatment. And it really is sad for parents or caregivers, right? When they know that it's so important. There might be some life-threatening things going on, and yet the person does not want to be in treatment. Um, the most we can do is validate their um, I might try to use some mind reading. Like I know it's really, I'm guessing it might be really scary, the thought of starting yet another treatment. And it might be really scary to think about making treatment goals when I know you've struggled so much with this in the past. Like your hesitation really makes a lot of sense in that context. Um, so you're not validating that they're not going, but ultimately they are the one who has to want to be there. And as a parent, I might go to family connections, so if a loved one doesn't want to go, the parents or the families can still go, and learn as much as they can and practice radical acceptance of a situation that is just so sad and unideal. I wish I had a better answer for that
mm.
one, but
Again, it's
mhm.
anecdotal, but I can say that I think every family connections group that I've facilitated, there's been at least one family where, as the parents have changed their way of interacting because they start validating and they start, regulating their own emotions and they set limits, the young person goes, oh, actually, this this psychotherapy thing might have something going for it. Or the psycho,
Mhm.
and then they go in because it's been modeled.
Exactly. Yeah.
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 Okay. So I think you covered a lot of how to validate, and what to do when they're either shut down or they're blaming. Those are what a lot of the questions are. You've certainly given us some great validation statements, which was another one of the questions. Um, okay. There's a group of questions which I've called not validating the invalid, which is things like
Mhm.
fictitious memories of events, or having a different memory of an event, or going against principles. I think you did cover that, but it might be or someone who's lying about drug taking or something like that. Is that when you're bringing in that you were saying before, the radical genuineness? Um,
Mhm.
you know, uh, I don't know if there anything more that you would add to that around that
Yeah.
sort of knowing what you can validate when there's invalid things being said.
Right. Yeah. Yeah. Like when people are lying or doing things we don't approve of, or so yeah, I think I saw a question that was sent around, how do I validate when someone's having suicidal urges? Like that's really difficult for me.
Mm,
Um, and again, so we often, the thing that is most distressing to us as family members is, oh gosh, there's lying, there's substance use, there's suicidal communication or attempts. And we really actually don't want to focus on those things when we're trying to validate at all. We don't want to validate certainly that we should be using drugs to maintain emotion regulation or anything like that. So I really often try to like, what about this person's behavior or their motivations for the behavior makes sense, right? Like finding out someone's lied, I might validate by saying, it sounds like you were really worried about how I might react if you told me this, right? So you're not validating the lie, but you're validating their worry or their difficulty coming to you. And then you might say, I'm so glad you came to me. Like I can see how worried you were and how hard this was for you. Um, Similarly with substances, right? Like, yeah, it seems like you're really struggling right now. Like you really are wanting some respite from all of the emotional turmoil you're experiencing. So I would just stay away from talking about the invalid thing, um, and talk about the valid thing. Like with someone asked about suicidal urges, I might respond by saying, "Oh, you're in so much pain right now."
mm,
Right? It's okay to validate emotional pain, but I'm certainly not going to say that suicidal behavior is valid or
mm.
there's anything that would make sense about engaging in suicidal behavior.
Yeah. Um,
Mhm.
I'm really conscious of your time. We've got 1 minute until you have to dash off to work. So
Okay.
I think we've covered all the themes and some of the questions that are in the chat. I would encourage people to rewatch the webinar because it was so very rich. We got so much information in there, and I know I'm going to be rewatching it, especially around the neuroscience of it all. That was really fascinating because that's new to me. And yeah, and just the fact that we can actually measure the impact of validation on the brain. And yeah, my personal message to people watching this too is if you're in a caring position, learn how to validate yourself and find other people in your life that can validate. Don't look to somebody that is struggling themselves,
Absolutely.
and it'll
Thank you.
come. Yeah. Well, look, thank you so much for your time and your expertise and for putting all your effort into researching in this area because it's really, when people can be helped, it's really great that, people like you are going out there and finding better ways of doing it.
Oh, well, thank you. Thank you so much for the invitation. It was really an honor. I don't frequently get invitations to speak in spaces where there are families and loved ones or people with lived experience. So it's so nice to get to connect with people who really know what it's like and they're really going through it. And
Mm.
so I hope that, this was helpful. Thank you so much. Yeah.
Yeah, great. All right. Well, I'll let you go and we'll stop recording. Thanks.
Okay.